A patient with type 2 diabetes experienced a weight loss after starting a new diabetes medication. If this patient's weight loss is due to the new medication, which of the following agents is most likely responsible? So, in order to answer this question, we have to know the weight favorable anti-diabetic medications. Now, there's going to be two classes that we need to know. Those are going to be the GLP-1 agonist and the SGLT2 inhibitors. Now, I have a mnemonic to help you remember these two drug classes that are going to cause weight loss in patients with diabetes. So here I have a image of this boy gulping down a drink. Okay, so imagine this boy gulping down a sugary drink, and as soon as he gulps down this drink, he's going to pee it out. Okay, so him gulping down this drink is going to help you remember that we're talking about the GLP-1 agonist, which sound like gulp. And the peeing out part is going to help you remember that SGLT2 inhibitors are going to be also involved because SGLT2 inhibitors are basically going to cause patients to pee out glucose. So this is how we can remember that SGLT2 inhibitors are going to be representative of this boy peeing out. Now, if you gulp out if you gulp a sugary drink and pee it out, then this is going to be basically a form of weight loss. So this is how we know that GLP-1 agonists and SGLT2 inhibitors are going to be the weight loss causing drugs in diabetes patients. Now, here in this image, I also have a pan. Okay, so this boy is cooking something and then he's going to gulp it down. So this is to help you remember that GLP-1 agonists are going to be associated with pancreatitis because pan sounds like pancreas. This is a very high yield side effect of GLP-1 agonists, so this is why I put this image. Now, this is to help you remember what is going on if you forgot the mechanism for these two drug classes. So GLP-1 is going to be a hormone that is going to be secreted by our small intestines when food reaches the small intestine. And when GLP-1 is secreted, it is going to go to the pancreatic beta cells, and then it is going to cause an increase in CAMP levels in the beta cells, and this is going to cause exocytosis of insulin. So GLP-1 is going to be responsible for the exocytosis of insulin. Now, SGLT2, as I said earlier, is going to make patients pee out glucose. So we have this SGLT2 channel in the proximal convoluted tubule, and SGLT2 inhibitors are going to inhibit this channel. So now glucose cannot be absorbed into the blood, and so now we're going to pee it out. And as you can imagine, if we have too much glucose in our urine, then this can increase the likelihood of UTIs. So to answer the question, the correct answer is going to be answer choice C. So the two medication classes that we're going to be looking for is going to be GLP-1 agonist as well as SGLT2 antagonist in a question that asks us which diabetic medication can cause weight loss.